Hi, I'm Dr. Troy Morrison. I am a fellowship-trained orthopedic surgeon, and I work at CMH Orthopedic Spine Center in Bolivar, Missouri. What causes my hip pain? And in my opinion, that's the most important question, because hip pain can sound simple, but it's very complex. There are a lot of different things that can cause hip pain. We always think about arthritis, but there's other things like sciatica or pinched nerve pain. There's pain you can get in your hip from your sacroiliac joint. There's tendonitis, there's bursitis, there's piriformis syndrome, there's labral tears, there's impingement syndromes. So even though it sounds simple, it can be a very complex situation. And the most important thing I do as a physician is diagnose what's causing your pain. Because if I don't know what's causing it, I can't treat it. What type of doctor or who should I see for my hip pain? And you want to see a physician who's trained in treating all the different causes of hip pain. For hip pain, that would be a physician trained to treat the causes that radiate pain from the back, as well as pain directly from the hip, like arthritis, tendonitis, or bursitis. That specialist would be a fellowship-trained orthopedic spine surgeon like myself. We're trained to treat pain radiating from the back, from the SI joint, or from the hip itself. When should I see my doctor? I think conservative treatment is always the best first choice. And when you're at home, things you can do is number one, rest. You can use anti-inflammatory medications like ibuprofen, Tylenol, or Aleve, and use ice or heat. When your pain gets bad enough, it affects what you do every day, to the point where you're modifying what you do or not doing the things you need and want to do every day. That's when you should see your orthopedic specialist. What can we do to prevent hip pain? I believe our joints and muscles are designed to move and keep moving. The more you do, the better. Do I need a hip replacement? Many times the answer is yes, but not always, and definitely not in the beginning. Like I mentioned before, we should always try conservative treatment first. That would be things like physical therapy, anti-inflammatory medications, prescription arthritis medicines, or maybe injections. We need to diagnose and get an understanding of what's causing your pain before we jump into any invasive treatment. With hip arthritis, the definitive treatment or the treatment to cure your hip arthritis is a hip replacement. And here at CMH, we have the most advanced technologies and techniques to do hip replacements. We can do a traditional posterior approach. We can do the direct anterior approach. We can do a minimally invasive posterior approach. And we have the technology to do robotic total hip replacements. All those help us fit the best procedure for each individual patient that allows us to treat you in the very best way we can. At CMH, we believe that each person deserves the very best care from well-trained physicians. We believe that you are a person, not just a number and not just a diagnosis. It's our job to help you realize your hopes, dreams, and responsibilities.